Hi, this is Dr. Paul Reifenrath for Upper Level Canine. Today is going to be a Q&A session. So we've got some questions from some of Karen's clients that I think were really great questions, and we'll dive into them. So the first one I want to go over is, can you ensure that all vaccines are safe? So it's a good question. So vaccines that are provided to your pet by your veterinarian are generally regarded as safe and effective. That being said, there are some adverse reactions that do develop. They are quite rare, and most of them are very mild. So first, let's jump into what is a vaccine and what does it do. So a vaccine is a killed or modified live version of a virus or a killed version of a bacterial protein or a bacterial cell that is made into a vaccine. This is typically injected underneath the skin or in the muscle, or with Bordetella vaccines, usually given by oral or intranasal route. And by doing this, we are stimulating the immune system to produce antibodies against the viral proteins or bacterial proteins. So the immune system has a memory, and once it's exposed to these things, if it gets exposed again during a natural infection, it's going to produce antibodies, and these antibodies are proteins that are deployed to fight off infection. They will help kill the virus or bacteria and prevent clinical disease from developing. So we have modified live viral vaccines. These are vaccines that have a very long, durable immunity, sometimes for the life of the animal, or like in our case, for the life of the person. And we also have our bacterial vaccines, and killed viral vaccines usually have a shorter duration of immunity. They need to be boosted periodically at a recommended dosage regimen to provide effective immunity. So let's get into some statistics about adverse vaccine reactions in dogs from 2023 to 2024. So the overall adverse vaccination rate was 19.4 adverse vaccine reactions per 10,000 doses of vaccine. So that's a 0.19% adverse reaction rate. So the majority of these vaccine reactions were mild, causing some fever, some lethargy, and maybe some injection site swelling. So small and toy breed dogs tend to be a little more susceptible to our adverse reactions. So French bulldogs, they tended to have the highest adverse reaction rate at 55.9 adverse reactions per 10,000 doses. Dachshunds had a rate of 49.4 adverse reactions per 10,000 doses, and Boston Terriers had 44.9 adverse reactions per 10,000 doses. So young puppies are at slightly higher than average risk, and we're looking at about 25 adverse events per 10,000 doses. So the majority of these adverse reactions occur within about 3 days of having a vaccine. So true anaphylaxis, or severe allergic reaction to the vaccine, typically occurs within 5 to 30 minutes of receiving the vaccine. The individual vaccines adverse reaction rate, the leptospirosis vaccine had 53 adverse reactions per 10,000 doses. Rabies vaccines averaged 38.2 adverse reactions per 10,000 doses. The DHPP, or distemper parvo vaccine, had 20 adverse reactions per 10,000 doses, and the Borrelia or Lyme vaccine had 43.7 adverse events per 10,000 doses. So if we look at the severity of the reactions too, mild reactions are by far the most common. These are typically going to be fever, a little bit of lethargy. We may get some transient injection site swelling. These account for about 45% of all adverse vaccine reactions. Usually they occur within about 24 hours of the vaccine and usually resolve within about 24 to 36 hours. So if we get into moderate to severe adverse vaccine reactions, these represent about 15% of adverse vaccine reactions. And usually they need some medical intervention to control the symptoms. And usually these are going to be vomiting. We'll see facial swelling. We'll see hives developing. These can be a little bit more severe. And typically dogs recover pretty quickly from these, but they do need some medical intervention. So true anaphylaxis is a severe life-threatening complication, allergic reaction to the vaccine. And this can occur to other things as well, things that dogs ingest, getting bee stings, things like that. And it's just an abnormal response by the immune system. And symptoms typically include acute onset vomiting and diarrhea and cardiovascular collapse. And usually they occur within minutes of getting the vaccine. So this is not something that we can predict. And typically it needs to be aggressively managed because this is a life-threatening complication. So typically in these dogs that have anaphylactic reactions, we will discontinue all future vaccines. That's just too risky for the dog to have any vaccines in the future, even rabies vaccines. So this is extremely rare, and it occurs in about 0.006 to 0.01% of all vaccine doses. And in 35 years of practice and given thousands and thousands of vaccines, I only saw this 3 times in my career. And then if we think about the worst case scenario would be mortality. So this occurs typically after an unsuccessful resuscitation of an anaphylactic event. So these are very, very rare, and the rate is 2.4 deaths per 1 million vaccinated dogs. But when it happens, it's not a good situation for the dog or the owner. So let's get into some important points about vaccinations too. Number 1, vaccines save lives. Bottom line, they do. Vaccines can cause some adverse effects. Most of them are mild, and most of them don't need any medical intervention. So for the diseases that we do vaccinate for, the risk can be pretty high. And that depends on the lifestyle of the dog and whether they get exposed to other dogs and to wildlife. So for some of these diseases that we vaccinate for, distemper virus, parvovirus, leptospirosis, influenza, there is a risk of death with getting these infections. And some can be very high, especially with parvovirus and distemper virus. So with infection with rabies is universally fatal. So if a dog gets it, any animal gets it, they're going to die. So that's why we really recommend, it's required to get rabies vaccines in virtually every state in the country. So our resident wildlife, our raccoons, our foxes, our coyotes, our skunks, bats, and others are the reservoirs for these diseases. So they can carry these bacterial and viral infections, and they may not be affected clinically by it. But they can release these viral and bacterial species into the environment through their bodily excretions or through bite wounds if the dogs have that close contact with the animal. So if your dog experiences a vaccine reaction, there's a few things to consider. Number 1 is, did your dog receive multiple vaccines at their vaccine visit? This tends to be a problem with small and toy breed dogs and in some puppies. We rarely see this in large breed dogs. That can sometimes overwhelm their immune system for giving 3 or 4 vaccines at the same time. So it's best in those cases, usually we recommend splitting those vaccines up, and it requires more frequent visits to the veterinary clinic, but I think it's safer for the pet, especially for our toy and small breed dogs and sometimes our young puppies. So we also need to consider if the dog was exhibiting any illness at the time of vaccination. So it's really important to communicate to your veterinary staff if your dog is showing any signs of illness prior to that vaccine. So, and that being said, if your pet is ill for any reason, it's best to not consent to a vaccine and until the illness is resolved completely. So if your dog has had previous moderate to severe adverse vaccine reactions, so reconsider vaccines and discuss the risk with your veterinarian. There can be some options, but usually we end up minimizing these animals' vaccine burdens over time. So if we have mild vaccine reactions, sometimes we can manage those effectively by pre-treating your dog with an antihistamine, usually using diphenhydramine. And usually we give that a few, probably 10 minutes before the vaccine itself. And this can minimize some of those minor adverse reactions. If your dog exhibits some lethargy and fever after the vaccine, we can usually prescribe a nonsteroidal anti-inflammatory medication like carprofen or meloxicam that are very effective at controlling just the achiness and the fever that dogs can experience with vaccines. So work with your veterinarian and try to develop a safe and effective vaccine that'll keep your dog vaccine schedule that can keep your dog protected. The next question that we're going to dive into is there a way to treat hot spots without a veterinary visit and antibiotics? So what is a hot spot? So a hot spot is an area of intense moist dermatitis, typically occurs on the underside of the neck, the face, the rump area, and sometimes on the flank. So these can develop really quickly and they can expand in size within hours. So these are areas of the skin that are very inflamed. They're red, they're oozing this sticky serum pus material, and they really smell awful. And they're extraordinarily painful for the dog depending on their size. Small ones, not so much. The large ones can be excruciatingly painful. And the dogs will aggressively bite and scratch at these areas, and that can further traumatize the wound and drive any bacteria deeper into the wound. So what causes hot spots? The biggest one is allergies. So environmental allergies are, by far the most common cause. And occasionally we'll see insect bite hypersensitivities to fleas or biting flies. There are some contributing or promoting factors for hotspots. The biggest one is dogs that have a very thick, long hair coat. So our golden retrievers and our German Shepherds, among other dogs. So hot, humid weather is another one too. We're not really sure why that happens, but we tend to see them more often in July, August, and September. So swimming is a big factor. So dogs that are swimming, they may stay wet for a very long period of time, especially our long-haired dogs. They're not drying out effectively. And that can actually macerate the skin and cause some superficial damage that'll set themselves up for these infections. So also post-grooming, we can see dogs that get some clipper burn from having the groomer get a little bit too close to the skin, or if they have a real hot clipper blade, that can cause some superficial damage to the skin and kind of trigger the events for a hot spot. So what are some of the preventative strategies that we use for hot spots? Allergy management is probably the big thing. So medications, frequent bathing, immunotherapy, certain diets, when we covered that in a lot of detail with a previous talk. So also rinse and dry your dog thoroughly after bathing and swimming. So, and make sure the underside of the neck and underneath the collar are dry. That tends to be, especially with swimming dogs, that tends to be the spot where they get these hot spots the most, is in the underside of the neck and around the collar. So the other important thing is really good year-round flea and tick prevention using the oral monthly products. So how do we manage hot spots, and can we treat them without a veterinary visit? And best answer to that is that depends. Depends on the size and the severity and the location of these hot spots. So if we can identify the beginning stages of hot spots where they're about a quarter size or smaller, those can be very effectively treated with topical management at home. So first what we do is we clip the hair over and around the wound, and be gentle, be careful. They can be very, very painful with this. The next thing we do is use an antibacterial soap or like a chlorhexidine skin cleanser to gently, very gently cleanse the skin of that area. Then application of a topical antibiotic or a hydrocolloid gel, probably 3 times a day for about 5 to 7 days, can usually stop these in their tracks and allow them to heal appropriately. So for larger or multiple hot spots, we do recommend going to your veterinarian and having them treat these. So for really large lesions, sometimes brief sedation is necessary to clip and prep these wounds because they're extraordinarily painful. And it's just not pleasant for the dog to have to experience that. So we use reversible sedation to get those cleaned up and treated. So facial hot spots, these are tough ones. So these usually occur right underneath the ear canal on the side of the face. And these usually require oral antibiotics for at least 3 weeks and usually some anti-inflammatory medications to put out the fire on the skin. These tend to be really deep hot spots rather than on the other parts of the body, they tend to be more superficial. So we don't always need oral antibiotics. Your veterinarian can certainly set you up with effective topical medications to get these under control. A little caution, over-the-counter hotspot remedies typically are not very effective, and some of the ingredients within those products can be very irritating to the affected skin. So usually we don't recommend using those. Your veterinarian has quite a few that are very effective and very gentle to use on the skin. So certainly discuss that with your vet.